Seeing children that can't speak yet come into the clinic can be heartbreaking. The looks on their little faces, you can just tell that they're miserable. The parents of these children are also mentally and physically exhausted. The puffy cheeks, the red eyes, the barking cough, the high fever, they are all just symptoms. But the child can't tell us what is causing these symptoms. On the other end of the spectrum are the perfectly healthy children that come into the clinic that we have to immunize. When you walk into the room as a nurse to give shots, there are usually two types of children. The one type is laughing and playing and completely oblivious as to what is going on. The second child is already crying and shaking because they're terrified of what's going to happen. Today I'm going to tell you about a super nurse. Super nurse would be able to walk into a room with a child that can't speak and immediately tell what is wrong with that child. She would be able to tell that the 6-month-old baby boy that has been crying for 2 days has ear pain. She would also be able to tell the mother of a 3-year-old that's suffering from a urinary tract infection that her symptoms would be relieved shortly with antibiotics. Super nurse would immediately bring a calming sense to the room. Super nurse would be able to touch a child and calm them down immediately. Super nurse would be able to walk into the room to give immunizations and the child would immediately calm down. Super nurse would be able to give immunizations without the child having to be held down because they were fighting because of the calming presence that she has. Today I told you about super nurse. Super nurse would bring a whole new world into the medical field. Super nurse could be a parent's best friend. In reality, I'm a pediatric nurse, and some days I already feel like a super nurse.